Welcome to my channel. Please watch and subscribe, like, comment and share and hit the bell button for more updates. Here's my new video coming up. Let's watch this.
Hi everyone! We are on our way to Wyndham Grand Hotel for Jam meeting. So let's check it out! I'm with my friend Divine. Way to Wyndham Grand Manama for our meeting of Prima D3, Vitamin D3, the Sunshine Vitamin.
our attendees to Jamjoom Pharma event in Bahrain. My name is Muhammad Najib. I am country sales manager for Jamjoom Pharma in Bahrain. Just want to welcome all of you in our event in Bahrain. Hope inshallah to enjoy this night and hope inshallah to add to all the information, valuable information to all of you. Let me also welcome our chairman and our speaker, Dr. Wyndham and Dr. Maher, and welcome our marketing colleague, Dr. Ali Jazim. He is a marketing manager for Jamjoom Pharma portfolio for general and GIT medicine. Hope inshallah to enjoy this night and hope inshallah to see you again and again in more events in Bahrain. Welcome, Dr. Ali.
Thank you very much. Good evening and Assalamu alaikum. I will not take much time, although I can take more time, but I will not, try to put myself between you and the speaker and the chairman. So the objective of the 2 days meeting is to highlight the vitamin D role in the clinical practice, and this is very important era. So I'm very happy and feeling a lot of pleasure and pride that Dr. Wyndham is available, and Dr. Maher Shaheen is available with us. So today we will have the chance to have their clinical experience and expertise, which will help us to understand this topic. So anyway, I will not go into the further this one. Thank you very much, Dr. Wyndham and Dr. Maher Shaheen, for to be available with us. I just want to give you some details and some insights and some introduction about Jamjoom Pharma. So Jamjoom Pharma is a basically Saudi-based company, and now my own journey or my own association with Jamjoom Pharma is more than 13 years. So I have a good history with Jamjoom, and Jamjoom Pharma is right now the third largest manufacturing company or pharmaceutical company in Saudi Arabia. So the point here is that it is not very old. Jamjoom started in 1999, and within just 20 years of time, Jamjoom Pharma became the third largest pharmaceutical company in Saudi. So I will just give you this. This is our factory in Jeddah, and this is actually our welcome message that we are always trying to offer quality products, and we are a corporate which is available globally, and we are a leading pharmaceutical company in the region. And
in 2022, last year, the medical community celebrated 100 years of vitamin D. So we have a huge data about vitamin D. These days, vitamin D is considered as a hormone or pro-hormone more than vitamin. Vitamin D deficiency is extremely common due to low dietary intake and indoor lifestyle with sun-avoiding behaviors. The skeletal health consequences of vitamin D deficiency have long been recognized. More recently, it has become appreciated that low vitamin D status leads to muscle weakness, falls, and potentially a lot of non-skeletal morbidities. Tonight, Dr. Wyndham will discuss the health hazard of vitamin D deficiency. Dr. Wyndham.
Thank you, Dr. Maher. Thank you, Dr. Ali. Thank you all for being here in a hot Friday evening, leaving your kids and families in your rest day. I'd like to thank Jamjoom also for giving us the opportunity to meet many friends and colleagues that I haven't seen for a long time. My presentation is very brief. I'll go straight to the topic. First of all, I have no conflict of interest disclosures at all. The first slide is a question to you all. Do you consider vitamins deficiency as a serious disorder? Now, I wanted to have a vote here, but I will just ask you to think about it. You're here to attend a talk about the vitamin, and most of you are convinced that vitamins can be a serious disorder. And let me just go through some of the vitamin deficiencies that we all know. For example, vitamin A, you know that vitamin A can cause night blindness, and in certain cases it can lead to xerophthalmia, and it can actually lead to blindness. Folate deficiency is known to cause megaloblastic anemia, very famous at causing neurotuber defect and birth defects and even neonatal death. Same to B12, megaloblastic anemia, and also neurological conflict. Niacin can cause a disease called pellagra. Pellagra is a disease that's described by 3 Ds, dermatitis, diarrhea, and dementia, and can eventually lead to the 4th D, which is death. So as you can see, not to mention the vitamin K and the bleeding disorders that accompany the vitamin K. Vitamins can be a serious disorder. Now moving on to vitamin D, most of us have practiced in the days where rickets were a disease of the kids, and it was a very debilitating disease. As you can see in this child, there's a bowing of the legs and the knocking of the knees, fractures, short statures, and complete disability just because of the vitamin D deficiency. In adults, we see cases with osteomalacia, and we see more serious cases with osteoporosis, which can lead to fractures. And as you know, fracture of the femur in elderly can cause fatality in 25% in the first year of fracture. So this is how serious it can be for a vitamin D deficiency as well as the other vitamin deficiencies. So I'd like to move on and describe to you how to handle vitamin D. Vitamin D is measured by estimating the 25-hydroxy vitamin D, which is called calcidiol concentration. According to the Institute of Medicine or the National Academy of Medicine, the range, it should be between 20 to 40 nanogram per ml, which is equivalent to 50 to 100 nanomole. And I'm sure most of you are aware of the 2 units described here with a conversion of 2.5 between nanogram and nanomole. So this is roughly the target that we have for our patients, with some exceptions that I will mention later. Now, to describe the categories of vitamin D status, we say that the category of sufficiency, when we have a 20 nanogram per ml or a 50 nanomole level or more. Deficiency is defined by less than 12 nanogram per ml or 30 nanomole. In between is called insufficiency. Now, the risk of vitamin toxicity is exceedingly rare, but it's usually defined by level of 100 nanogram per ml or 250 nanomole. In certain exceptions, as per the National Osteoporosis Foundation, International Osteoporosis Foundation, and Geriatric Society, in elderly people, it is recommended that we define sufficiency by not 20 nanogram, but rather by 30 nanogram. And this is the only exception we have, as most societies agree that 20 is the normal for most populations. Patients from having a vitamin D deficiency. There are 3 ways of doing that. You can do 1 or 2 or the 3 together. Adequate sunlight exposure to give you enough vitamin D for the day. Adequate intake of vitamin D, which is a little bit harder than the sun exposure. You need to focus on certain food that I will go through that have a high percentage of vitamin D, or just taking a vitamin D supplements or doing it all together. So let me move to the sun exposure. Now, exposure to the arms and legs for 6 to 8 minutes can give you enough supply if you do it every 2 to 3 days per week. And that is done usually between 10 a.m. and to 3 p.m. in winter time and 9 a.m. to 3 p.m. in summertime. But this is also depend on the other factors such as the skin pigmentation. As I mentioned to you, darker skin people have difficulty taking the UVB light and forming vitamin D. So you can see more vitamin D levels in fair skinned people, Caucasians, versus the darker skinned people. Also the age, as we age, all of us will have less conversion of vitamin D through the skin. And of course the location, geographical location, and the sun and the season of the sun, because it depends on the location of the sun and the wavelength of the UVB light that comes from the sun to the skin. Let me show you what happens when the skin, the epidermal layer, is exposed to the sunlight. the UVB light actually breaks down the 7-dehydrocholesterol, which is available in the epidermal layer of the skin, and forms cholecalciferol, which is vitamin D3. Also, dietary intake that you can take, whether it's D3 or D2, all of it goes to the liver for a two-step process of hydroxylation at the carbon 25 in the liver, and carbon number 1 at the kidney.
Meeting is over. Now we are going to Atmosphere Restaurant for dinner. Time to fill the stomach. Kabila, di ba may mais? Saan? Doon. Thank you for watching. Hope you enjoy. Have a lovely day, everyone.